Dr. Meschino, I have been diagnosed with diabetes, and I'm afraid of some of the side effects due to some of the medication. What can I do to help manage my blood sugar?
Well, let me first say that there are many good and safe medications for diabetes, so you don't have to fear them. However, the less medication you need, the better. In fact, proper diabetes management requires more than just drugs. The effective management requires attention to 5 major factors. They include taking your prescribed medication, but also proper diet, physical activity, the use of certain supplements, and stress management in some select cases. Now, in terms of diet, there was a breakthrough study in 2003 by Faccini and Saylor published in the journal Diabetes. Their new diet was administered to type 2 diabetics. They were able to reduce the death rate by 50%, reduce the need for kidney transplant by 50%, and also stabilize kidney function. So compared to the traditional diabetic diet, their diet provided significantly fewer carbohydrates, more protein, and more fat, but they were the good fats primarily. Now, in a future video, I'll explain the details of that diet. But in this video, I want to emphasize the often neglected role of certain supplements in diabetes management. And that's because certain supplements have been shown to lower blood sugar in diabetics and also help to slow and reverse kidney damage, prevent and help to slow the progression of cataracts and macular degeneration. These are leading causes of blindness in diabetics, and also improve weight management. All of these factors are vitally important in the global management of a diabetic case. So the blood sugar lowering supplements include chromium, vitamin C, and vitamin E. So chromium and vitamin C and vitamin E at certain doses, specific doses, have been shown to stimulate the insulin receptor on the cell so the cell can pull blood sugar into the cell more effectively and use it for energy. And the antioxidants, vitamin C and vitamin E, at the doses that have been shown to be useful, also do other things because they're antioxidants. They also slow the progression of cataracts and macular degeneration, and they help to protect the kidneys against free radical damage, which is very common in a diabetic situation. So you get all of these benefits from these supplements. Now, if weight management has been a problem for you, then I would urge you to use the combination of chromium, HCA, and catechins from decaffeinated green tea at specific doses because they will help you reduce body fat in conjunction with some physical activity. How do they work? Well, they help to increase your lean mass. That elevates your metabolic rate. They block the conversion of carbohydrate into fat so you don't store fat in your fat cells so easily. And they turn on brown fat so your body will burn more calories while you're at rest. Give it off to the environment as heat. Now, there's no doubt that weight management improves diabetes management if you are overweight, because when your body fat comes down, your blood sugar will come down, your insulin comes down, your triglyceride levels also come down. Now, here's the other thing that's important. Recent discoveries have shown that diabetics often have low levels of vitamin D, and the low levels of vitamin D are causing some of the insulin resistance so the cells can't use blood sugar that effectively. Supplementation studies in diabetics show that if you give them 1,000 to 4,000 IUs of vitamin D, very often it improves insulin sensitivity so the cell can use blood sugar better. It helps the pancreas make more insulin, which helps, and also reduces inflammation across the body, which is creating part of the insulin resistance and the difficulty using blood sugar. Now, here's the other part that's interesting, is that African Americans have a higher incidence of diabetes mellitus, and African Americans have a very high incidence of what? Vitamin D deficiency. Why is that? Because they have increased melanin in their skin. And the melanin acts as a shield preventing ultraviolet light from penetrating deep enough so they can make their own vitamin D in their skin. But recent studies have shown that African Americans often need 4,000 IUs a day over many months for their blood level to come up to what is the ideal blood level, which is 80 nanomoles per liter. So here's a case in point. I was asked to give a lecture on the use of supplements in diabetic management at a major diabetic center a number of months ago. So I went in and there were dietitians and diabetic nurses and many patients. I explained the action of these supplements. I came back a few months later and an African American woman came up to me and said, you know, I'd been following all the diabetes management procedures and I was still very erratic with my blood sugar and my body weight. I went on to the supplements that you talked about in conjunction with diabetes management, and all my parameters have improved significantly. And her diabetic nurse was there and said, you know, it's absolutely amazing the difference that supplements have made. So I just want to point that out because it's an important part that's been neglected. Two final considerations then, stress management and physical activity. You know, if you're under a lot of stress, your adrenal glands will pump out a lot of cortisol. That causes the liver to release a lot of sugar into your bloodstream. That can raise your blood sugar. I've seen cases where people who are really slim develop diabetes just because of the stress factor. So if stress is a factor for you, then meditation, yoga, relaxation, deep breathing exercises, doing endurance exercise helps to lower your cortisol levels. And so do certain supplements. These adaptogen supplements like ashwagandha, rhodiola, schisandra as a combination helps to suppress the release of cortisol from your adrenal glands. So if you're under a lot of stress, you might want to take that advice to heart. Last thing, physical activity. You know, many studies have shown that when diabetics become more involved in endurance exercise, even just 30 minutes of power walking 5 to 7 times a week, lowers their blood sugar, lowers their triglyceride levels, helps to increase insulin sensitivity. They burn fat more effectively. They have much better cardiovascular fitness. You know that diabetics often die from cardiovascular complications. So being cardiovascularly fit is really important. Now, you've heard that before. I just want to emphasize it. But the bottom line is this. You need more than drugs for effective diabetes management. So I would urge you to consider the strategies that I've explained here, discuss them with your physician and qualified nutrition advisor, because I've seen these strategies make a big difference in many diabetic individuals. So I hope this was helpful. I'm Dr. James Meschino. Thanks so much for watching.